Welcome to Mind Mentor. In this video, we will discuss about typhoid fever. Typhoid fever, often simply referred to as typhoid, is a potentially life-threatening infectious disease caused by the bacterium Salmonella enterica serotype Typhi. This bacterium is primarily transmitted through contaminated food and water, and it is more common in areas with poor sanitation and limited access to clean water. Here, I will explain typhoid in detail, covering its causes, symptoms, diagnosis, treatment, prevention, and its historical significance. Causes: typhoid fever is caused by the bacterium Salmonella typhi. It is primarily transmitted through the ingestion of contaminated food or water. People who carry the bacteria but do not exhibit symptoms, asymptomatic carriers, can still transmit the disease to others. The bacterium can multiply and spread through the bloodstream, affecting various organs and systems in the body. Typhoid fever symptoms can range from mild to severe and typically appear 6-30 days after exposure. Common symptoms include 1. Fever. A prolonged high fever is a hallmark of typhoid fever. 2. Headache, often severe and continuous. 3. Abdominal pain. This can be generalized or more focused in the lower right quadrant. 4. Weakness and fatigue, due to the body's efforts to fight the infection. 5. Rose-colored spots, small pink flat spots on the abdomen and chest. 6. Gastrointestinal symptoms, diarrhea or constipation, and sometimes nausea and vomiting. 7. Enlarged spleen and liver. These organs may become enlarged and tender. 8. Cough and sore throat. These symptoms can occur in some cases. Severe complications can arise if the infection is not treated, including intestinal bleeding or perforation, which can be life-threatening. Diagnosis. Diagnosing typhoid fever typically involves a combination of clinical evaluation and laboratory tests. Doctors may consider the patient's symptoms, travel history, and potential exposure to contaminated food or water. Specific tests to confirm the diagnosis include blood cultures, stool cultures, and serological tests. Blood cultures are the most reliable method for identifying the bacteria. Treatment. Typhoid fever can be a serious and life-threatening disease, but it is treatable with antibiotics. Commonly prescribed antibiotics for typhoid fever include ciprofloxacin, ceftriaxone, and azithromycin. It is important to complete the full course of antibiotics as prescribed by a healthcare professional to ensure the complete elimination of the bacteria. In addition to antibiotics, treatment may also involve supportive care to manage symptoms such as fever and dehydration. Hospitalization may be necessary for severe cases or individuals at high risk of complications. Prevention. Preventing typhoid fever is primarily focused on hygiene and sanitation measures. This includes 1. Vaccination. 2 main typhoid vaccines are available: an injectable polysaccharide vaccine and an oral live attenuated vaccine. These vaccines are recommended for travelers to endemic areas and for individuals at higher risk of exposure. 2. Safe food and water. Avoiding consumption of raw or undercooked food and drinking only treated or bottled water in areas where typhoid is prevalent. 3. Hand washing. Frequent and thorough hand washing with soap and clean water. 4. Sanitation. Improved sanitation infrastructure and proper disposal of waste can help prevent the spread of typhoid. Historical significance. Typhoid fever has had a significant impact on history. It was responsible for many deaths during wars and in densely populated urban areas with poor sanitation. One famous case is the role of Mary Mallon, also known as Typhoid Mary, who was an asymptomatic carrier of the disease and unknowingly infected numerous people in early 20th century New York City. Her case led to a better understanding of the transmission of typhoid and the importance of identifying carriers. In conclusion, typhoid fever is a potentially severe bacterial infection caused by Salmonella typhi. It can be prevented through vaccination, improved sanitation, and safe food and water practices. Early diagnosis and prompt treatment with antibiotics are crucial for a full recovery. If you like our videos, please like and subscribe to our channel, Mind Mentor.